We're going to do a quick review of PPE doffing based on the new checklist that's been placed in your ambulance following equipment maintenance. That checklist should be located in the rear of your vehicle, ideally on the rear left door. A couple of doffing basics. Much like medication rights, there are 4 rights to proper doffing. Having the right setup, as in making sure that you have a red biohazard bag, normal trash, a disinfectant, soap and water, and/or hand sanitizer. Following the right steps, allowing the chemicals to work for the right amount of time, and then disposing things in the right place. Certain items go in a red bag, certain items can go in normal trash. So set up your safe doffing area. The ideal location is the rear of your vehicle on the left-hand side. Make sure you have a red biohazard bag, sufficient disinfectant, a normal trash bag or trash receptacle, hand sanitizer and/or soap and water. Step number 2, remove your gown. This could be a gown, Tyvek, suit, or coverall, as all are currently in use within our system. Slowly and carefully remove it. Place it in the red bag. Now it's time to disinfect your gloved hands. Take your disinfectant, wipe your gloved hands, and allow it to stay wet for at least a minute. We refer to this as wet time or dwell time, and it allows the chemicals to work to inactivate viruses and bacterium that may be on your hands. Following the disinfection of your gloves, carefully remove your eye protection. Depending on the product that you're using, you may wash them with soap and water or certain types of disinfectant. There is a link to proper care for your goggles on the COVID-19 website. You can find what to use and what not to use on your UVEX goggles. If you're using a safe disinfectant, ensure that you've got 1 minute of wet time. Next, remove your N95 mask. This is done by pulling the elastic pieces that are currently securing it to the rear of your head, over your head. Try not to touch the mask part itself. Place it in the red biohazard bag. Ensure that all your biohazards, your gown, coveralls, suit, your mask, and anything related used to disinfect that are placed in your red bag. Tie a knot to secure your red bag, and clean the exterior surface of the red bag where contact was made with your gloves. This ensures that if someone touches your red bag downstream, that you've done your best to minimize the chance that they can be contaminated. Now it's time to clean other items. Your radio mic, your radio, your keys, or your iPad. Anything that you touched with gloved hands or came in contact with the patient. Use a disinfectant that's safe for those materials and allow 1 minute of wet time or dwell time. We're going to clean our gloved hands again with the same disinfectant that we used in the earlier step. Allow for 1 minute of wet time. The final cleanup includes discarding those gloves into normal trash and then cleaning your hands with soap and water. If soap and water isn't available, hand sanitizer is a substitute, although soap and water is the ideal mechanism to clean your hands. Just an overview, we're doing this to decontaminate and prevent cross-contamination. When you use soap and water, you need at least 20 seconds of scrubbing and washing. If you use hand sanitizer, you need at least a minute of wet contact time. If we're using disinfectant, the contact or wet time depends on the agent. Most of our agents require at least 1 minute. The biohazard bag we use for the N95 and the gown that have come in contact with the patient. Thank you. Be safe. If you have questions, please let us know.